Hello, everyone. It's great to be with you today. We'd like to talk with you about the climate crisis in health in order to frame nurses and midwives' understanding and responses to this planetary crisis. We're really excited to be with you today and want to acknowledge that what we'll talk about with you today is informed by the participants in our virtual exchange on this same topic that we host here at the University of Pennsylvania in the United States. And we're also grateful to the Nurses Climate Challenge for granting us permission to use slides in this talk with you today. The Nurses Climate Challenge slides are used in accordance with Penn Nursing's participation in that initiative. And we're really excited to be with you. It's a pleasure and a privilege to be with you, and we'd like you to know who we are.
Hello everyone, my name is Emma. I'm a registered nurse and I work in the National Health Service in England and with the COIL team at the University of Pennsylvania.
Hello everyone, great to be with you all. My name is Nina Gentarial. I am a PhD student at the University of Pennsylvania.
And I'm Sarah Kagan. I'm a professor of gerontological nursing, also at the University of Pennsylvania.
Hello, everyone. My name is Kiara Perez, and I'm a nursing student here at the School of Nursing at the University of Pennsylvania.
Hi, everyone. My name is Maria White. I'm an advanced senior lecturer at the University of Pennsylvania. Sarah, over to you.
So we'd like you to begin our conversation today by taking a moment to think about what you bring to mind in considering our environment, climate, the climate crisis, and health. It's important for us to do that sort of thinking so that we can bring our understandings together and learn from a common place. We all need to recognize that nurses and midwives play an important part in a crisis that the world is facing today. Our entire planet is in crisis, and time to act is running out. But there are terrific opportunities for us all to act and to act effectively. When we think about the planetary crisis, that's really a triple crisis. All life, including human life, but also all other forms of life, are affected by the climate crisis, the air pollution crisis, and the crisis in biodiversity. The health effects of these triple crises are manifold. There are so many ways in which health is affected. And because we as nurses and midwives hold a great deal of societal trust and have knowledge and the opportunity to learn even more, we then can combine our social contract with that trust to act, and to act in light of our social contract to serve our communities and the trust that our populations hold with us and for us. Our domains for action are education, practice, research, service, and importantly, activism. We need to speak out to help others learn more and act effectively to mitigate the climate crisis. As we do that, we need to consider sustainable development goals. And that's where I'm going to turn back to Maria to ask Maria to talk with us more about sustainable development goals and the climate crisis.
Thank you, Sarah. When we are discussing the environment, health, and the climate crisis, it is important to talk about the Sustainable Development Goals. The Sustainable Development Goals are a blueprint to achieve better and more sustainable future for all of us, thereby addressing global challenges that may be faced. So, some examples can be hunger, poverty, clean water, sanitation. You are able to see these on this slide. The 17 Sustainable Development Goals build on decades of work by countries and the United Nations. We are reminded by Mr. Simon Steele Executive Secretary of the United Nations Framework Convention on Climate Change, that all the Sustainable Development Goals are deeply intertwined and interconnected. Progress on all the Sustainable Development Goals is impacted by what we achieve in regard to the single Sustainable Development Goal. If we fail on addressing climate change, the other Sustainable Development Goals will be unachievable. Next slide, please, Sarah. So we know that climate change refers to long-term shifts in temperatures and weather patterns. In framing this, the relationship of climate and health, how do you think climate impacts health? Do you know of anyone whose health has been impacted by climate change? I'm guessing, in fact, that you do. Whether or not that person's health has been affected, the impact is there. Let's take a look at some tangible examples in some subsequent slides. Next slide, please, Sarah. Before we look at those tangible examples, let's talk about the underlying cause. Humans began burning fossil fuels like coal, oil, and natural gas at the end of the 19th century. Burning fossil fuels releases greenhouse gases into the Earth's atmosphere. The most prominent is carbon dioxide. When greenhouse gases build up in the Earth's atmosphere, they trap in the sun's heat. Over time, this trapped heat has led to an increase in the average global temperature. The more greenhouse gases we have in our atmosphere, the warmer our planet gets. It is almost like a blanket that is wrapped around the planet Earth. As indicated in the graphs to the right of this slide from the National Climate Assessment, the increase in carbon dioxide concentration in the atmosphere and the increase in global average temperature are directly correlated. Some places on the planet have higher increases in heat than others, such as the North and the South Pole. As the poles get warmer, large amounts of ice melt into the oceans. These global changes in temperature and sea levels lead to a multitude of health effects. Next slide, please, Sarah. So I mentioned already about how this change in temperature and climate in general is a significant threat to health. And the impact of human-induced climate change is increasing nationwide and globally. So the rising greenhouse gas concentrations result in increase in temperature, changes in precipitation, increase in frequency and intensity of some extreme weather events, and those rising sea levels. So the next two slides demonstrate examples of climate impact on human health, showing drivers, exposures, and health outcomes. So let me just point to one example, like extreme heat. There will be more severe and frequent and prolonged heat events, leading to elevated temperatures and thereby causing heat-related deaths. Pointing on this slide here, extreme heat, outdoor air quality, flooding. Kiara will talk about some of these in slides to come. Next slide, please. In continuing from the prior slide, and as I mentioned, Kiara will discuss further, we also have vector-borne diseases, water-related infections, food-related infections, and important mental health and well-being. Next slide, please, Sarah. As this slide unfolds here, it is a great visual summary of the prior slides that I was talking about and puts a great reference point for slides to come. Climate change impacts a wide array of health outcomes. And in the center here, showing most significant climate change impacts, the rising temperatures, extreme weather, rising sea levels, and increasing in carbon dioxide levels. The next circle around that are the effect on exposures. And outside of that circle, the subsequent health outcomes that can result from these changes in exposures. So back to our initial question, do you know of anyone impacted by climate change? How did it impact health? I will share with you one of my best friends when I was a child was severely impacted by floodwaters in my hometown. There was food insecurity present, difficulty getting funding for aid and disaster relief, subsequent mental health impact, and forced migration. Their home was destroyed by contaminated floodwaters, thereby creating unlivable mold in their home. They also lived in a hotel for 3.5 months. I wanted to share this example with you because, as I mentioned earlier, we probably all know someone who has been impacted by climate change. It could be on a smaller scale or on a larger scale. And Kiara, over to you.
Thank you. Now we're going to elaborate a little more on the effects of the climate crisis. One of the major effects that we've been experiencing is extreme heat. There have been more very hot days, higher humidity, and longer and hotter heat waves. Populations are concentrated in areas most exposed to warming, leading to 220 million additional global heat wave exposures in 2018. Illness and death from heat stroke, acute kidney injury, dehydration, and increased violence are becoming more prevalent with the extreme heat. The most vulnerable populations are those with chronic cardiovascular and respiratory conditions, outdoor workers and players, people without air conditioning, pregnant women, people taking certain medications as well. While there are vulnerable populations, the heat doesn't just affect the frail, ill, or elderly. In fact, 1/3 of all heat-related emergency room visits in the US are among young men. Next slide, please. Along with extreme heat, there's air pollution. The heat is increasing wildfires, smog, and pollen. Over 90% of the world's population lives in areas with dangerous air quality. 4.2 million annual deaths from lung cancer, chronic respiratory diseases, heart disease, and stroke are caused by outdoor air pollution worldwide. Humidity and flooding leads to indoor mold growth, which can exacerbate asthma and allergens. The most vulnerable populations are people with pre-existing respiratory conditions such as asthma and COPD and cardiovascular disease. Next slide, please. There's also changes in the ecosystem, including changes in range, lifespan, virulence, and population of certain animals and insects, including mosquitoes, which can carry West Nile virus, malaria, dengue fever, and Zika virus, as well as ticks who carry Lyme disease. This extreme weather leads to changes in breeding grounds and behavior of these animals. Climate change is one of several human-mediated factors which are most likely driving zoonotic diseases such as COVID-19. Everyone is affected, but people who spend time outdoors and pregnant women are most vulnerable. Lyme disease cases have more than doubled since the 1990s, and the number of countries that are now deemed high risk for Lyme disease has increased by more than 320% in that same period. The geographic range of ticks in the US has also increased over 50% since 1998. Next slide, please. There are also many severe weather events that are happening more frequently and more intense with the climate crisis. There are more frequent and severe rains, floods, droughts, fires, and major storms, which can cause housing displacements and decreased access to health services and medications. 152 of 196 countries saw an increase in annual daily population exposures to wildfires from 2015 to 2018 when compared with 2001 to 2004. 2 billion additional flood exposure events are expected by 2090. These events are particularly damaging to mental health as well. While everyone is affected, the most vulnerable populations are children, older adults, people in poverty, and people with disabilities. Destruction of infrastructure from severe weather leads to equipment and supply shortages. For example, Hurricane Maria in Puerto Rico led to medication and medical supply shortages across the world. Changing rainfall and flooding decreases security in water and food supply, which leads to 3.1 million deaths annually, according to the World Health Organization. Next slide, please. There have also been lots of mental health effects related to climate change. Depression, anxiety, anger, hopelessness, PTSD, uncertainty, and grief, and anticipatory grief have all been common with the climate change crisis. Familial, financial, and societal impacts are often unquantifiable and difficult to articulate. Climate change is expected to lead to 200 million more forced migrations by 2050, which can contribute to civil conflict. Physical health impacts of climate change also have implications for mental health, such as when individuals struggle with disease related to climate change or when they lose physical infrastructure, such as their home or business. The most vulnerable populations are children, the elderly, pregnant women, and people with pre-existing mental health conditions, those in poverty, homelessness, and first responders. The UN International Organization for Migration estimates an additional 200 million migrants by mid-century. This applies to the United States as well. For instance, 215,000 Puerto Ricans have arrived in Florida since Hurricane Maria. Health professionals are also experiencing these impacts because they are on the forefront of emergent care with the crisis response. The migration also leads to changing patient populations with more complex health needs, including language barriers, insurance, health history, trauma, and etc. There are also limited resources with greater patient needs. Next slide, please. It is important for us as nurses and midwives to understand the impact the healthcare industry has on the climate crisis. The global healthcare sector, which includes hospitals, medical facilities, and medical supply chains, accounts for nearly 5% of global greenhouse emissions. Climate change will pose new threats to public health, giving healthcare responsibility to reduce their greenhouse gas emissions. Net zero healthcare is a concept meant to fight the climate crisis while improving public health. Net zero refers to the idea that we minimize all of the greenhouse gas emissions resulting from our organization's activities to essentially zero when accounting for sources that we influence. The key is to source their energy from renewable sources, for example, the use of solar panels, supply chain contracting with companies who report their emissions and are using science-based targets to draw down those emissions, and reducing the healthcare waste. And now I will pass it on to Nina.
Thank you so much, Kiara. And now taking that to think about our populations, the planetary crisis has impacted health both directly and indirectly, and has been undermining many of the social determinants for good health, such as livelihoods, equality, and access to healthcare and social support structures. Disadvantaged populations are disproportionately affected by climate-sensitive health risks, including women, children, low-income communities, displaced persons, older populations, and those with underlying health conditions. Next slide, please. To touch briefly on each of these communities, I'll discuss that many of the groups live in urban areas that are prone to extreme heat. Some may also live in housing that does not have adequate insulation or cooling. For communities of color, living in buildings that are older or in poor condition can increase other indoor air pollutants, especially after floods and extreme weather events. Older adults often have limited mobility, making it difficult to get to safety during extreme weather events. These events can interrupt older adults' medical care, making it harder for them to be transported with their correct medication and health equipment. These weather events can also cause physical and emotional trauma to low-income communities. In addition, high temperatures and extreme heat can cause children to experience dehydration, heat exhaustion, and heat cramps, and children's bodies take longer to acclimatize to these warmer environments. Next slide, please. Therefore, the planetary crisis is a global crisis with far-reaching consequences. When we think about action, setting priorities is paramount. We must ask ourselves, what aspects of climate change matter most to us? Is it reducing greenhouse gases, preserving biodiversity, or protecting disadvantaged communities? Our priorities can differ based on our perspectives and values. It's important to respect these diverse viewpoints. And once we have our priorities in order, we need to define the scope of our actions. Are we acting on an individual, community, or global level? What resources do we have at our disposal? Next slide, please. So where do we begin? Education is a powerful tool. Educators can teach climate science, sustainability, and responsible citizenship to foster awareness and empower future generations. Practitioners can implement sustainable practices. This includes individuals, businesses, and governments can adopting eco-friendly technology to reduce emissions and conserve resources. Researchers play a vital role as well in understanding climate change, its causes, and its consequences. They develop solutions and provide evidence to drive policy. Service is another domain. Volunteering with climate-focused organizations, participating in environmental restoration, and supporting community initiatives contribute to positive change. And as for advocacy, advocacy and activism are potent forces for change. Activists raise awareness, hold leaders accountable, and mobilize communities to demand climate action. I want to note that it's important that all domains are interconnected. Collaboration between researchers, practitioners, activists, educators, and volunteers is essential for holistic climate solutions. Next slide. As nurses, we have a professional and moral obligation to act. We are on the front line of healthcare, witnessing the health impacts of the planetary crisis firsthand. This is a call to action. Nursing programs are uniquely positioned to prepare the next generation of nurses to address planetary-related health challenges. By developing curriculum and practical training, including simulation and clinical experiences, we can prepare nurses to effectively respond to planet-related emergencies. And next slide. From change to action. So to effectively address these challenges, we must implement population-level interventions and strategies involving emergency preparedness and public awareness campaigns to protect disadvantaged populations. We can continue to educate the public about climate change and its health impacts and encourage advocacy for climate action. We can also advocate for strong policies to drive meaningful change and ensure accountability. Community engagement and collaboration is key. Government, healthcare, academia, and community organizations must work together to address climate-related health challenges. Next slide. So now, let's learn from the NHS to understand the direct and indirect impact of healthcare delivery to greenhouse gases. I'll now turn to Emma, who will share our expertise on sustainability to achieve net zero.
Thank you so much, Nina. Let's have a look at this NHS activity chart here. We can see that certain types of activity generate more carbon than others. Do you notice a pattern here? Let's have a look at the column under acute settings. We can see the circles here are bigger than those for community settings. This suggests that in general, care provided in acute or emergency settings is higher carbon or producing more carbon emissions than in the community. We can also see that, for example, medicines and travel to acute settings such as hospitals are also major contributors of carbon emissions. Knowing this, some of the ways we can influence and reduce our carbon emissions linked to healthcare as nurses could include developing our skills in providing clinically appropriate remote or telehealth services to reduce travel to acute institutions. We also have an opportunity here to reinforce the vital role we play in public health and health improvement to support people to stay well, reducing the need for them to access more acute or urgent services. Next slide, please. So let's think a little bit more about these acute settings, often hospitals, which is where we have a lot of our higher emergency and higher complex care. Thinking about the carbon emissions linked with these hospitals, I wonder, what do you think a greener hospital would look like? You have any ideas, or you've seen some interesting examples of this, please share them with us in the chat. So thinking about a greener hospital, they would have clean energy being used to support them, innovative systems to reduce waste and recycle, use digital and technology innovation to improve the systems that they work within, and think about that effective use of resources. So now let's think about some more concrete examples of actions that we can all take to reduce the carbon emissions linked to healthcare. Next slide, please. There is such a range of activities that we can get involved in, and sometimes climate change and its impacts can really feel overwhelming, as can the number of things that we could be doing. So it can be challenging to know where to start or what to do. First of all, I think in these instances, it is important to look after our own personal well-being and seek out support to make sure that we are well. Some people find that joining a workplace sustainability network or green champion group can help them find supportive colleagues and a safe space to talk about these issues amongst friends, and also consider activities and actions that they can do. Small actions, especially those that are part of an organized, coordinated, systemic approach, can cumulatively make a huge impact. We really do have the power to collectively make meaningful change. So again, thinking about actions we can take, let's consider this idea of reducing, reusing, and recycling. What can we reduce? Is there anything that we can reuse in a safe, clinically safe way? And when it comes to recycling, do we have the appropriate systems in place to segregate waste appropriately and actually make sure we are recycling everything that we can recycle? Maybe think about that next time you're in a clinical placement and see if there are opportunities for you to get involved. The health benefits of nature exposure are increasingly recognized by both health providers and patients. There is evidence that in-bed recovery time is around 20% shorter for patients whose view includes greenery. So let's think about ways we can develop hospital-based community gardens or tree planting activities around hospitals. And actually, this could be of real benefit to patients and their families, but also staff and everyone who works around hospitals and healthcare settings. We can also look at ways where we can reduce carbon, but also improve the care we provide. So for example, when working with patients around their respiratory health, we can not only optimize their use of an inhaler by ensuring that they are using it appropriately and effectively, thus ensuring their improved respiratory health, but we can also see where clinically appropriate, if they can move from a metered dose inhaler, which is higher carbon, to a breath-actuated inhaler, which is lower carbon. So here we can really see we can reduce carbon and enhance health at the same time. Next slide, please. These actions that we can take also exist in this research space. So we can look to how we're conducting our research and seeing if there are more environmentally friendly ways of conducting research. But there's also a lot of work that we need to do around what we are researching. We do not fully know the extent of which climate change is impacting on health, and we need to make a difference and understand that more. We can also monitor unintended consequences of these decarbonisation plans and really take that system-wide approach to see what's happening here. And an interprofessional approach here is key. So working with colleagues across the system is important. So we really can make a change. There are so many different places that we can make this change. We have that power within us as healthcare professionals. And we're really excited to see the potential amongst the group here today. There are, next slide please, a range of resources that we hope will be helpful to you, and I'm sure this will be, we can keep adding to this throughout the program. Next slide please. We really look forward to our discussion. Thank you so much for listening to us during this session, and here's to a greener future with us all working on it together. Thank you so much.